I'd like to welcome you to another Fireside Chat. This chat is being made on November 5th of 2021, and I'd like to welcome you to this. I have a few things that I'd like to let you know and a little detail that I'd like to fill you in on, but let's go ahead and start with the most important thing. We will be doing booster shots for the Moderna vaccine on November 11th. You can pick up the forms for consent at the front desk. And so please have those picked up and filled out, and we'll be doing the vaccinations. And we expect that they will be done in the Palmetto Conference Room, which is across from the Blue Ridge Rooms. So just so you know, Blue Ridge Rooms, November 11th, and there will be a little bit more detail that's coming. But we'd like to know how many people are going to be there. So if you could fill out a consent form and have it back to us a couple days ahead of time, that would be really, really helpful. Second, you've all received the rate increase letters. None of us like to see a rate increase, and that's always a challenge of every year. The rate increases were 4.9% for the independent living areas and the assisted living and memory care area, and 6.1% for the nursing home and licensed area. Now, the reason for the difference is because the amount of staff that we have. The lion's share of the increase this year actually goes to staff wages and staff benefits. As you know, whenever you increase a staff wage, there are more taxes and staff benefits and percentage of staff tax benefits that we pay. So primarily to staff wages and benefits. And so I'm really excited and thankful for that. This next year will be challenging because we're trying to hold the line on costs as best we can with supply issues and those kinds of things. But we're excited for 2022, and I'm excited that we weren't finding it necessary to go up higher than that at this time. So thank you. On the ancillary pricing sheet, there are a couple of clarifications I'd like to make. One is when each month, when meal credits are used by residents, they can carry, or you can carry 200 credits over to the next month, and you can do that 11 months of the year. From December to January, however, we're not able to carry over any of those points, and that's for an accounting reason. But every other month, you are able to carry 200 credits over. So I just wanted to clarify that. Also, the second person fee for the apartments, that remained the same for the A through E apartments as it was in 2021. No change at all. In the F building, there is a change to increase it. The reason for the difference is because the F building rates were frozen for a couple of years during construction. And so the second person fee is a little less than for other second person fees. And so we're establishing parity, and we're using a 2-year program to get the F building and second person fees to be the same as everyone else is paying for the second person fee. So you can be pleased that we didn't go up on that rate for the A through E buildings, and for F building there is, and it's a little bit more than 4.9%. So we just wanted you to be aware of that and why that is. Then a couple other reminders. This month we have open enrollment for Medicare, and during open enrollment you choose the provider that you wish to be your Medicare provider. Rolling Green does have some contracts for insurance for people who need rehab. And those contracts include the traditional Medicare, Aetna, Humana, United, WellCare, and Cigna. The letter that is going out today actually only refers to several of them as an example, but I did want you to be fully knowledgeable that we also have Aetna, Humana, UHC, WellCare, and Cigna, just for your reference. Also with the letter this week, I'm so pleased that we're able to open up the campus more. Generally, what it does is for residents who are vaccinated, we're able to open up rooms to the capacity that they were designed for. So the large Blue Ridge room, for example, can seat over 120 people. And so we'll be able to move to events that are larger and have more residents. We'd recommend that you wear masks in there. It's not required, but we'd recommend that anyway. The chapel service, we'll still have 2 chapel services this coming Sunday, and during that, Chaplain David is going to be requesting information for you of what time would work the best for having a consolidated single chapel service for Sundays. So we're excited about those things. Also, something that may not be clear is right now we're not allowing children under 12 into our buildings for visitation. The reason is because they're in schools, and the schools are the way that COVID is really being passed from family to family at this time. And it's one of the bigger ways that we're seeing with our staff and with other people in the community. So they have just announced in the last few days that vaccinations for 12-year-olds and under are available for a certain age group. Then once we get through enough of that and we get enough of those people vaccinated, then we'll be able to have children under 12 again. The one exception to that is we are allowing infants up to a year. And that's because they're primarily with their parents and they're not with other people. And so we are allowing infants basically in arms that are up to a year old to come in and visit. So you can see your grandkids. Again, visitors need to be wearing masks in all public areas. We'd recommend it in your apartments and homes and cottages as well. But visitors need to check in and do the standard precautions that we've got. We'd recommend social distancing. In the dining room, we're not able to have visitors and families in yet, unfortunately. And more than a COVID issue, that's an issue with staffing. And staffing has improved a little bit, but it's still a challenge, and we don't have sufficient staff to really open the dining venues entirely up. And we don't like it, but we are thankful that we're making do and things are coming along. You may be aware that in the last few days, the federal government, Center for Medicare and Medicaid Services, CMS, and OSHA, the Occupational Safety and Health Administration, have issued regulations relating to mandating vaccines for employers. What that means for Rolling Green is that by December 5th, all of our employees throughout our campus are to be receiving at least their first vaccine. And their second vaccine needs to be received by early January. Now, having said that, there are exemptions that are available, and so we'll be working with our staff on that. But we want you to be aware that we have a policy, we are finalizing it at this time, and we really are encouraging our staff to be vaccinated because we believe that it helps keep you safer, and that's why we're here. Of course, we want to have all of our staff vaccinated. We know that it's safer and better for the staff and their families, but it's also safer and better for you, and that's our primary reason. And so we are looking forward to having about 100% of our staff vaccinated, and we will have the policy out, as I mentioned. We'll have that out very shortly for staff, and we'll be working with staff through that process. We will, of course, be offering opportunities for people to be vaccinated here for staff. So we're looking forward to that. A couple other things, just so you know. We are in the process of updating the hallways in the A through E apartment buildings. The color scheme will be similar to that of the Foxglove building, and we're looking forward to that. We can't make the halls any wider, but we can certainly make them a little lighter and prettier. So we're using, again, a similar color palette that we've had before. And along with that, we're starting with hallway C2, and then we'll be going to hallway C1 and also hallway D2. Probably D2 next, but and then followed by C1. This is a project, it's fairly expensive with carpet and paint, and also a substance that we're putting underneath the chair rail to protect the walls. And so it's actually a 2-year project. So we will be working our way through the A through E apartment hallways to get that done, but it'll take us a little while. We also have now published copies of the disclosure statement. We have that available every year. And if you would like a copy, you can talk with either Lindsay Reedy, my assistant, or else you can pick one up from marketing. They'll be happy to help you with that. Finally, I'd like to mention again, with the letter is an attached grid, which shows a little more detail as to what we can do with the opening up. And there is one other item that I just wanted to confirm. For residents who have been vaccinated, while you're in the public areas, you are not required to wear a mask. And it can be misread on that sheet, and I just would hate for anybody to misread that and feel unhappy about that. we are making progress at Rolling Green, and I'm pleased that we are making progress with COVID. We're making progress with many of the different things that we're working on. And I'm glad, most of all, that we're able to open up and that our residents and the staff have been as healthy and safe as they have been. Have a healthy day.
Thank you.